So before she actually lays down, I'm going to do a couple more things. And I'm going to ask you to cover your ear with your hands. And I'm going to say 3 words. I want you to repeat them.
White, bird, light.
Okay, now your other one.
Floor, window, pillow.
Good. Okay. Now we've already done a Snellen test on her. Her visual acuity is 20/20 without glasses. So now I'm going to check her apical pulse. Apical pulse is over here. Now I'm going to have you lean forward. I'm going to check the base, which is right second intercostal. You can sometimes hear murmurs here. Now I'm going to check her radial pulse. Nice and strong. Her brachial pulse. Good. And I'm going to check the lymph nodes. It's right here. Any pain? There's no lumps. Let's go back, do this one here. The same. Good. Okay, and the same lymph node over here. Now I'm going to check her hands. I want to check her capillary refill, which should be the amount of time after pressing that the blood returns should be less than 3 seconds. And we have to do 1 finger. Very good. Okay. Now I'm going to check her hand strength. Okay, so I want you to push against me. Okay, put your hand down, push, push, good. Do that again, push against me, good. Okay, now I'm going to have her lie down. Now with her laying down, I can check her abdominal area. I'm going to check for any, again, masses. I'm going to just touch gently. And I'm going to inspect to see if there's any moles, any lumps. I'm also going to listen to her valves now, her heart valves. So I'm going to turn this around and I'm going to listen with the bell of my stethoscope to the same 4 valves. if you can turn slightly to the left. I'm going to listen to the bass again. Okay, good. Now I'm going to listen to her abdomen. I want to listen to all 4 quadrants. Make sure I hear good vowel sounds. Then I want to listen to her ascending aorta. Now I'm going to percuss in a zigzag motion each 4 quadrant. Good. That sounds good. Okay, now I'm going to check her hips. So I want you to bring your knee up. She's just had knee surgery on this knee, so her range of motion is going to be very limited. So just do whatever you can do, okay? Now I want you to try to move your knee in and out. Okay, good. Now I want to do it against resistance, but I don't want you to hurt yourself. Okay, again. Okay. So put that foot down, and I want you to lift your leg up. Okay, down. Now do it again against resistance. No, as long as it's no pain. Good. Can you lift it up and try to press down? Good. Nice and strong. Now can you move the leg out? Okay, and in. Now try to move it out against resistance. Good. Okay, now we're going to bring this one in. Okay, and bring it out again. Now, bring it in again. Okay, I want you to go this way and out this way. And I'm going to have you do it again against resistance. Again. Okay, good. And I want you to swing your leg out and back in. Okay. Now I'm going to check her toes. She has toenail polish on, but I would be typically checking her capillary refill. So we're going to say that yes, she does have good capillary refill. So then I'm going to check the range of motion in her ankles. Push. Push up. Okay. So up and down, flex and extend. Okay, up and down. Okay, now I'm going to sit her up. So now I'm going to actually check her popliteal pulses bilaterally. Good. Good. And now I'm going to check her tibial pulse. I'm just checking more to make sure I can feel it and that it's strong. And now I'm going to check her pedal pulse. Excellent. So I'm going to inspect her legs, make sure there's no edema. There's a little bit on this leg because she just had knee surgery. So I'm going to check her range of motion in her feet, which would push down against my hand. Okay, now push up. Okay, down, up, and she has toenail polish on, but we're checking capillary refill, which is actually really good. Now I'm going to test the Babinski reflex, which a normal reflex is when I touch the pencil underneath her foot, her toes should curl in. That's normal. Good. Okay. Now I'm going to touch her light sense. First, before I do that, I want you to take your heel and I want you to go like this down your shin. Move it down your shin. This is a neuro check. And I want you to do the same thing with the other one. Okay. I want you to put your hands on your legs and I want you to turn them over. Turn them over. Good. Okay. Now I'm going to put 3 items in one hand and I want you to close your eyes and I want you to tell me what they are.
A paper clip. A penny. A half of a Q-tip.
Now what I'm going to do is I'm going to, in the other hand, I'm going to change it up a bit, and I'm going to write a letter or a number in your hand, and I want you to tell me what it is.
C. 8. M.
Very good. Okay. So now I'm going to check her deep tendon reflex, and since I don't have a hammer, I can use, I'm not going to do this knee, because again, she just had knee surgery, but I would do it right about here. So on here I'm going to, there we go, okay. So I'm going to do a positioning test. This is another neuro test. I'm going to have her close her eyes. Now I want you to tell me if I'm pushing your finger up or down.
Up. Down. Down. Up.
Okay. Now with the other one.
Up. Up. Down. Down.
Excellent. Okay. Now I want you to stand up. Can you get up off of here? Careful. Now I want you to turn this way. And I want you to just walk a straight line towards the window. Now turn towards me and come back and walk heel to toe if you can do that. Okay. Now turn around and I want you to walk on your toes if you can. Turn around. Now can you walk back on your heels? Okay, now you're going to stand here and I'm going to just test some, I want you to, it's light sensation, so I want you to tell me if when I touch you, it's sharp or dull. Okay, close your eyes.
Dull. Sharp. Dull. Sharp.
Okay.
Dull. Sharp. 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 Dull.
Okay, now we're going to do the Romberg test. She's going to stand here with her eyes closed. And I just want to check to see how well she balances herself for about 20 seconds. I'm here supporting her in case she falls. Okay, very good. Now I want you to turn around, face the table, and I want you to just do a slight bend on one knee. If you can't do it with your knee, your right knee, I understand, but we'll sort of pretend that you did. Okay,
I can try.
just don't hurt it. I don't want you to hurt it. Okay, that's good. All right, Well, thank you very much.
Thank you.
We're all finished.